I'm Madeleine Harkins from Winmore, Pennsylvania, and I'm a school administrator. When I got into my later 20s, I was thinking, let me do something. I like to be competitive, and I thought I could be a successful runner, so I started running marathons. And I've run 12 marathons at this point. So I was out with some friends for dinner, and I lost my balance in a restaurant, and I popped my knee, and I didn't feel anything actually at that moment, but my friends needed to help me up off of the floor. I think I probably should have realized something was wrong at that point. And then the next morning, my knee was very swollen, so I knew I had done something. So then that was a Saturday. I went and had an MRI first thing Monday morning, and I got in touch with Dr. Croft's office and went to see him that Monday afternoon. He had been recommended by doctor friends that I trust. I had a great experience when I called his office and told them what the situation was, and they told me I could come right in, and I thought it sounded like a really good fit. So when Dr. Croft looked at my MRI, we sat down and he told me that I had torn my ACL, a clean tear. He said that I also had 2 meniscus tears, and he explained that the ACL was an easy fix. We were decided on a cadaver ACL donor, and we would work through that. And he said the meniscus was the one that was tricky. And the next thing he said to me, which was the best thing he said to me, is, you will run again. We will get you to run again. So then I knew. I was emotional at that point, but I knew that it was a long road, but definitely there was light at the end of the tunnel. So day of surgery, when I arrived at Temple Hospital, I felt very comfortable. I felt like the day was perfectly planned out. When I met everyone who was part of my surgery, everyone was very friendly. The nurses at Temple made me feel comfortable, asked me what I needed. Everyone at Temple made me feel very good that day. It has been 4 months since surgery, but almost 5 months since I fell. So I haven't run any longer than 1 minute at a time in about 5 months. It's been hard. He said, don't push it, don't overdo it, listen to my protocol. He said it might seem conservative for somebody who runs 70 miles a week during season training, but you want to be able to run into your 60s and 70s. You don't want to just run one great marathon when you recover. So keeping that in my thought process is helpful. I'm looking forward to running Broad Street. That's in a few short weeks. I know that it won't be my best Broad Street race, but it'll be great to get out there, to stand in the big corral in the start line and feel like I have gotten to the point that Dr. Croft promised I'd be able to get to. I would tell any other runner or athlete that Temple Sports Medicine knows athletes, knows how athletes think, knows how important getting back to their sport is, and they do everything that they can to get you back there safely, quickly, and in good spirits.